Yeah, hi everyone. So I think like the main thing about this exam in general is that I believe personally that it's easier than what people say, because after all, if you think about it, you're just going in, talking to patients, and it's as if you're doing it in real life. So it shouldn't be like, it's even less stressful than doing it in real life, because like at the end of the day, no life is actually impacted by it. So just go through it with that mentality and you'll be fine. And be yourself. Like, I know that everyone says be yourself, but really be yourself. Don't just be a robot that just saying things to tick out the boxes. Like, be aware of what you are saying, as if the person in front of you was a real patient. So that's my little bit of advice. Yeah.
Yes, and I think, yeah, to touch on talking to a patient in terms of the mentality as you're approaching the exam and as you're approaching each cubicle, I do find it helpful just to think that you're just in clinic. You're just in wherever your clinic is at home and you're just talking to the patient. I know the conditions are a bit different, right? It might perhaps be in a different language and things, which so it's
What
difficult
makes it
sometimes
tricky?
to treat it like that. But that's the mentality that they want you to have, just to treat it as if it's like that. Because I think if you think of it as an exam where you're being assessed and you realize that there's an examiner there watching you, it can just make you freeze and trying to impress. And is that okay? But just, because you need to have that a bit of authority and confidence behind the words that you say. And sometimes I see that it's kind of like there's like the tonality the end of the sentence, it kind of goes upwards a
Yeah.
little bit, like you're
Yeah.
asking, is that okay? But you
Mm-hmm.
can't do that in an exam. Even
Yeah.
if you don't feel like it, you have to fake it till you make it. And to be honest, in an eight-minute consultation in a PLAB 2, it's quite easy to fake it.
Yeah.
So anyone can pretend, to have their psychology all sorted,
Of it. Yeah.
right? For a period of 8 minutes, it's quite easy to do that, right?
Yeah.
Because I'm sure everyone's had experiences where they've met people and they came across very good on first impression, but then you got to know them,
But
and
then,
then
yeah.
the story was much different. And so with PLAB 2, you have that luxury of being able to start a new first impression with each
Yeah.
examiner and each role player that you meet.
Which is really good because, for example, for me, I had the SimMan station and I really, really didn't do well on that one. I just went in and didn't know what to do. So, and then went out. So then I went with the mentality, I either leave this exam right now or I have to forget what happened and just move forward from here. And you have to go with the mentality that every single station is different than the other. So people in the next station won't know what happened in the station before that. So if you just try to push through and take every station on its own, then it becomes easier mentally during the exam, I feel. So, yeah. And again, because some people ask me, like, what would you do if you freeze during the exam and don't know what to say? So I would say,
Думаю, все культуру устроили.
oh, sorry, were you talking? Was it someone talking?
Yeah, I don't think she's aware that.
Okay. Yeah, so I was just saying that if whenever you freeze or don't know what to say next, just repeat what the patient just said and you'll move forward from there. Just do a small recap and then you'll get like your words again and just go through.
Yes, that's a good point. Yeah, that is definitely a big concern, isn't it? What happens if I freeze? What happens if I run out of things to say? I don't know what to say next, right? But you need to have that go-to thing, a plan, to prepare for those kind of instances, because it happens to everyone, doesn't it?
Yeah.
Where you just kind of lose your train of thought a little bit. It's more about how you deal with it, because we're all human beings, we all make mistakes. And so just be accepting that you will make mistakes in every single station. You're going to make a mistake and just have to accept that, because if you are striving for perfection or a very high standard, you don't need to, because
Just need to
high
pass.
standard is not required. There is no reward for excellence in this exam. It literally has no bearing whatsoever, whether you pass 10 stations or whether you pass 16 stations. So you need to meet the minimum requirement. And so you need to make sure you focus on your weaknesses, the things that will actually make you fail, so that you're at a certain threshold level in every area. Don't be one of those people that you know, focuses
Or
on
the
one area,
extra
is
mile,
really
yeah.
good at one area, but at the expense of others. And that's the same principle as well with your time management and your
Yeah.
allocation of time. You need to be very superficial. So, you know, you don't have the luxury of delving into too much detail in a particular topic here. You should delve into some topics in more detail than others to demonstrate your understanding. So that's one way of demonstrating understanding, is your allocation of time to key themes of a task. Yeah, for example, we'll talk about it with this case that we've got today, but if is this task an assessment focused station or is it a management focused station? Because they're not the same. So there isn't a set time where you should start management for each station. It's going to differ according to the task. So today we're doing Breaking Bad News stations. So guess what? Patients have usually already been assessed in most of the cases. They've usually been assessed, and it will always say in the task, the neurosurgeons have assessed the patient, right? So they've made it very clear. So they're not asking you as the junior doctor to reassess the patient again, right? So that's not the key theme of the task. It's more of a management focused consultation where you are breaking bad news. So if you spend 6 minutes on data gathering and then you break the news in 2 minutes, this is common. This is what people do because they're not allocating time to key themes. And so this is why I teach people the big thing to do. I'm a big fan of summaries. Okay, summaries are very important in OSCE based exam. Okay, so you need to summarize 3 key themes for data gathering and 3 key themes in management. Okay, so before you enter in the cubicle and when you're studying, you know, especially when you're close to the exam, you're focusing on high yield cases, but you should summarize 3 key points in data gathering, not to miss 3 key points in management.
Yeah.
That way, you delve a little bit into each of the key themes. Don't get stuck in one thing at the expense of others. And that way, you will adequately cover, you know, identify the key issues in the consultation and manage them. Yeah, that's what you do. And if you do that successfully, then you pass the station. You don't have to manage them perfectly, but you need to identify the problems and manage them. And those problems can be biological, can be psychological, can be social. We were talking just now. Patient 1 has stable angina. Patient 2 has stable angina.
But there's
Management is not the
different
same.
in
Yeah,
management.
you've all heard the buzzword patient-centered care. It's not called disease-centered care. Yeah, it's patient-centered care. That means patient 1 with stable angina, exactly the same type of stable angina he's got, right? And patient 2 with stable angina, they should be managed differently. So it's not a one-size-fits management plan for those because it's patient-centered care. So that's what patient-centered care means, right? So that means that we get the medical background of that particular patient. We get the psychological background, which can be mental health problems, of course, yes, but it can also be their mentality as they approach the consultation, what they're thinking, what they're expecting. ICE, yeah. So what their concerns are. That's why ICE is so important. You know, if this is why misunderstandings happen a lot of the time in eyes, because happen in consultations where they say, you know, they come out and they say that doctor's terrible because they tell you it all the time. And like your colleague, they'll say he's a terrible doctor, he's bad, he didn't do this, he didn't do that. Well, it's because he didn't do a nice assessment. If he did a nice assessment, if he asked, you know, if she was expecting antibiotics and he asked, you know, what she was expecting, and she said, I expect antibiotics, I think they would help. And then he explained to her why antibiotics are not of any benefit to her in this particular case. Then she understands, she comes out much satisfied. Yeah. So these misunderstandings with patients, they arise because of not addressing the components of ICE. So that's the psychological aspect, right? And then you got the social aspect, which is the patient's life, which is obviously important to the patient, right? So we need to, you know, manage according to that as well. Take that into account. So anything that you'd like to add, Doctor?
That's it.
Yeah, sometimes I do go on these rants for quite a long time. That's why sometimes my coaching sessions last forever.
It's okay, it's useful. So
Yeah, get carried away. Any comments or questions by anyone? We've got a volunteer. Thank you very much, Dr. Hansini, for volunteering for tackling this station. We've got Breaking Bad News station today, so that's kind of the topic of discussion. But, you know, we're flexible. If anyone wants to ask a question or make any comments or anything like that about anything, PLAB 2 or otherwise, then just unmute yourselves.
So yeah, I think we can start with the case, and then if anyone has any comments, we can leave it till the end, if that's okay.
Yeah.
Guys.
Bear with us, guys. This is our first session, so there's going to probably be some teething problems.
Technical issues. Okay,
Yeah.
so I guess we can start. So So usually to read the case, it's you have like 2 minutes. So we can start with that. Dr. Hashim, do you have the timer or do you want me to put it from my side?
Timer's on the slides, yeah.
Okay, perfect.
Yeah. Don't worry about that.
Okay.
When we on the next slide, it will have the task and it has the two timers. So one timer will be a 90-second timer. The other one will be 8 minutes.
Perfect. Okay, so whenever you're ready, doctor.
Yeah, all good to go.
Okay, let's start. Let's go.
Begin.
Hello, I'm Dr. Kananga, one of the doctors in the GP surgery. Can you please confirm your name and age for me?
Yes, certainly. My name is Adam Wilkins. I'm 45 years old.
Okay, wonderful. And what would you like me to call you?
Yeah, just Adam's fine.
Adam, okay. And I see you're here to discuss your X-ray report with me. Is that right?
Yes.
Okay, but before we get into that, I'd like to ask a couple of questions, if that's all right.
Yeah, sure.
Okay, can you just talk me through what has happened? What led you to getting this X-ray in the first place?
Yes, doctor. Yeah, I had a bit of an accident, at my workplace, and yeah, so I had to hurt my shoulder, so I went into A&E.
Right. Okay. And what sort of tests did they do for you at the emergency department?
They took an X-ray of my shoulder, and they also did like a chest X-ray.
Right. Okay. And did they tell you that there's anything wrong with the results, or did they explain it to you?
No, they said the shoulder X-ray is good. There's no fracture, and chest X-ray, I think they said they were going to get that reviewed, but it looked okay. They'll get it reviewed by a specialist or something.
That's good. All right. And were you given any medications or any treatment at that time?
Yes, they gave me some painkillers. They gave me some ibuprofen, and they gave me some paracetamol as well.
All right. Okay. So that's good. And how are you feeling now? Do you have any symptoms? How's the shoulder doing?
Yeah, I feel absolutely fine, doctor. Yeah,
Oh, that's good.
feel great.
Okay.
Yeah,
So
all
do you
healed
have
up.
any? Okay, that's good to hear. And any problems with moving the shoulder at all? Any loss of function?
Not anymore, no.
Okay, so you okay to get on with your normal life with the shoulder?
Yeah.
All right, okay. So have you experienced any cough or any difficulty in breathing at all?
Oh, no, nothing like that, no.
Okay, all right. Any chest pain?
No chest pain, no.
Okay, and just a couple more things. Are you running a temperature, or have you sort of had a high temperature in the last few weeks?
No. Been absolutely fine, yeah.
Okay, and have you lost any weight or any loss of appetite?
No, my weight's been normal, no.
Okay, good. And any night sweats at all?
No.
Okay, all right, that's fine. And do you have any medical conditions that you're aware of?
Oh, no, all fit and well.
Okay, and any medications, long-term medications, or any supplements?
No medications, no supplements.
Okay, that's good. And any allergies that you know of?
Oh, no.
All right, Adam. And just like to check, what do you do for work?
Yes, I work in a shipyard.
Okay, so what does that involve? Does that involve you working with asbestos at any point?
Yes. Now you mention it, yeah, they did tell us about 5 years back that they were
Right.
investigated and they've had to make some changes. Yeah, and they said that we were exposed.
Oh, okay, all right. Adam, do you have any thoughts about why you've been experiencing this shoulder pain and why I might have asked you to see you today?
Oh, I'm not really sure, to be honest, doctor. Yeah.
Okay, that's fine. Okay. Are you concerned about anything in particular?
Oh, no. I've got no symptoms. My shoulder's doing well. Yeah, absolutely
All
fine.
right. Okay, all right. So just apart from the X-ray results, do you have anything else that's that you're expecting from me from this consultation today?
Oh, no. Nothing at
Okay,
all.
that's fine. Okay, that's fine. All right. So I'd like to discuss the X-ray results with you now, if that's all right.
Yeah.
Okay. Would you like me to call someone for you or have someone present with you at the moment?
No, that's okay.
That's all right. Okay, so just a little bit of a recap. So you came into the emergency department with a shoulder injury, and then we've done some tests, as you mentioned, and we've taken an X-ray as well, and discharged you home. And the radiologist, the specialist, has had a look at the X-ray, but unfortunately, we don't have very good news for you, Adam. Okay. The X-ray did show some thickening of your lung tissue. Okay, of both the
All right.
lungs. Yes.
Oh,
And so you mentioned that you have a history of working in a shipyard, right? So I'm afraid that you might have, and as you mentioned, you might have been exposed to asbestos. So in this
yes.
scenario, we think that it is possibly a case of mesothelioma. It's a type of a lung cancer.
2 minutes
I'm
remaining.
really sorry to tell you.
Oh, gosh.
Okay. Yeah.
Oh, wow.
Mm. Yeah.
Are you sure, doctor?
Well, we do have a protocol that we need to follow to confirm the diagnosis, but yeah. So can you sort of take me through what's going on in your mind right now? I know this is sort of difficult news for you.
Yes, I mean, to be honest, I feel absolutely fine. Feel absolutely fit and well as a fiddle. So I don't know,
Mm.
I've got no problems with my life. Would never have thought I had problems with my breathing or lungs or anything like that. Are you sure about this,
Mm.
doctor?
So, but according to the X-ray, that's what we are really concerned about at the moment. So to really answer your question, we will have to refer you to a specialist, which will be done in about 2 weeks' time. Okay, you should be seen within 2 weeks. That's a suspected cancer pathway. So then you'll gain some clarity there. So they'll do some tests for you and also investigate, perhaps do a biopsy. Okay.
Right.
And you can also take someone with you for your appointment. Okay. And
Okay.
the specialist will sort of give you an idea about what sort of treatment they can offer you. Okay. Okay. Is there anyone else that you would like us to talk to about your situation?
No, that's okay. I'll probably when I get home, I'll speak to my wife.
Yeah. So there are lots of support groups as well we can get you in touch with. And there might be some financial compensation available. So the specialist will let you know about that. And if for
Move
any
on to the
reason,
next station.
okay.
Excellent. So there were some people trying to join, but when I click on the thing, it paused the timer, so I couldn't get them to join it into the meeting. But yes, so apologies for those guys that were waiting in the waiting room whilst we were doing that role play. How was that? How did you find that?
Nervous. I don't know. I'm not sure I did everything like properly.
Really? I don't think
Yeah.
most people, listening in, I don't think they would
It
agree.
was
I
really
think that
good.
was excellent. Yeah,
Thank
I'm
you.
really impressed with that. Yeah. You've obviously been reading my notes.
Exactly. I was like,
Right?
she's following
That's
the script without actually seeming like you're following the script. So it's really good.
Yes.
okay.
That's a very difficult balance. It's a very fine balance, isn't it?
Yeah.
Between having a pre kind of rehearsed idea of the things that you're going to say, but at the same time adapting and being present in the consultation. And you know, despite, you know, you say that you're nervous and stuff, it certainly doesn't come across in your performance, which was excellent. Yeah, it's very, very impressed. You pretty much, so, you know, the key themes, like, you know, for example, you spend a bit of time, you're showing the examiner, when you ask about work there, you know, you're showing the examiner that you understood that this was a key concept, right? And so, you know, you always show understanding, you demonstrate understanding by your selection of questions. That's why we always talk about taking a focused history, right? So you can see how that was focused, because there is a timeline, isn't there? Presentation, investigation, diagnosis, treatment, and now. There's a rough timeline. You know, there are other method or ways that you might call it, right? But generally speaking, there's a timeline. So for follow-up consultations, it's quite useful. But you don't want to allocate the same amount of time to each one. But you were asking specific questions that were related to this case in particular, because you know that, you know, the findings of the X-ray, was that discussed? That's an important question to select in a focused history, because we never have time to ask everything. So it really is so important to summarize things, the most important points. And, you know, so for example, so for the timeline, I really liked your selection of questions there in the timeline. Your baseline interpersonal skills are excellent. You're obviously a native speaker as well, which obviously helps. Yeah, so the section of the timeline, and then when you moved on to transitioned into your DDs, you know, the perfect level of detail, I think there, you asked about the shoulder, which is only natural to ask about that. But then you asked like the real information that you want to know, which is about, you know, the respiratory symptoms, local respiratory symptoms, and the systemic symptoms of flaws. So you covered all of that. They were all negative. Then you got a background about the patient. You asked PMAF. I call it, you know, PMAF. People are familiar with PMAF TOSA. I like to split it personally. It's just my personal preference to split it into PMAF, social, and ICE. And social will include things like travel and occupation and things like that. The reason I like to do that is, you know, it ensures that you do a little bit of a medical background, you do a little bit of a psychological consultation background of what they're thinking, and you do a little bit of a social. So you cover a little bit of everything. So I like to split it up like that. Yeah, and so you ask all those, and I do think ICE is very important. I always tell people that ICE, any emotion-based station, you must ask ICE. It's really, really important. So wherever emotions are heightened or are likely to be heightened, so I would say this is, you know, would be under that category. ICE is essential pretty much. So if you ever, because a lot of people, they say, yes, Dr. Hashim, when do we ask ICE? I don't know. And if I know that it's important to ask ICE, how do I ask it? Well, it doesn't have to be a specific thing, right? It's always best to start off with an open question, then follow up with a closed question whenever you're encroaching on a new topic anyway, yeah, for an effective data gathering. So ICE, you know, other than what we've discussed so far, did you have any other particular thoughts, you know, coming in today? Yeah, very, very vague. So you could almost ask that for every person. I would perhaps follow up with any specific closed questions related to ideas that you would want to ask specifically, like the Dr. Hansidi did today. She asked me about why we've asked you to come in today. Yeah, so that's a very good choice, a question, I think, for ICE. Yeah, and then in terms of you've been following the notes very well, so I don't really have anything that I would have added because you've covered everything.
So I couldn't sort of safety net at the end and the management part. So is that all right? Like, because I ran out of time.
I mean, that's not a deal breaker. For me, it wasn't, because there was many stations where I didn't have time to do that and I passed them. So it's not a deal breaker. But if you wanted to have time to do that, maybe you could have shortened the part when you were asking lots of questions about the shoulder. Like, it's good that you didn't forget to ask about the shoulder, which is a good thing. However, you could have shortened this part a little bit, and then you would have had some time for the signposting. But I don't think it's a deal breaker.
Yeah, I thought time management was excellent. I think you've delivered the news at the right time. You know, you got that sense towards the end that you know, it was closing, it was time for, like, it was ending, and so that was like a good natural conclusion. So you managed the time well, you covered all the key themes. I wouldn't say particularly for a Breaking Bad news station that safety netting is particularly, we don't need to force it in if it's not entirely essential, and your instincts tell you when it's essential. And so obviously you are referring them, and it's an urgent referral. So so really the only safety netting would be delayed or missed appointments, which, you know, I'm sure that you'd be able to chase that up anyway. So I don't think it's essential. Yeah, I do think that, you know, safety netting, I think people, it's good to trust your instincts. You know when it's like important. So if this was perhaps another, you know, first presentation of something, and there were some red flag symptoms, then, or perhaps you're going to try a particular treatment and you want to keep them in the community, manage them in the community, in the GP surgery, and you want to assess that, if there's any resistance to treatment, then they can come back. Those kind of things, I think it makes more sense. But here, that, you know, you've already taken the action. There's not much that's going to happen. The guy's got no symptoms anyway. He's fine.
Yeah.
And how else do you think it went? Other than safety netting and feeling nervous, was there anything else? Any other thoughts? So I'm going to do a nice assessment on you now. Have you got any general thoughts about how that went? Because we spoke before, just before we came live, and you said you haven't really covered Breaking Bad news, or you still have to review it.
No,
Or something
I was sort of reading the notes before
Yeah.
your notes for the cases. Yeah, that's about it. I haven't really practiced it.
Right. You know, because it's very effortless though. So that's
Thank you.
obviously very good. If that's, you know, that's your first time trying Breaking Bad news PLAB 2 station. It's excellent. In your work regularly, Breaking Bad news.
Yeah,
You're very good.
a little bit. Yeah, a little bit. Yeah.
Yes.
And it was
So
really
you've
good
got the
that,
experience.
sorry, it was really good that you asked the patient about like if he wanted family in, or if he had someone for support. Like those little touches, they really make a huge difference in the whole approach. So that's good.
Any other comments from anybody? Any comments or questions at all? You can leave a chat as well, guys. If you don't want to speak, or you can't speak. Dr. Sahwa says, fantastic history taking and great flow of speech, while the patient had negative symptoms, which was hard to get a response, but this is lung malignancy. I do have a comment, if that's okay. The tone was a bit jolly at the beginning, but the rest of the conversation was perfect. Also, the knowledge part, while Breaking Bad news, could have been delivered in small chunks, giving time to process such huge news. Okay. Yeah, I mean, the thing is that this is one of those I call them borderline Breaking Bad news, right? It's a bit of a grey area. You know, there is an argument not to use a Breaking Bad news kind of approach for a station like this. It's that there's no right or wrong way to go about it. The reason why, you know, in my notes that I do a Breaking Bad news spikes approach for this case is because the finding is relatively specific. It's quite a specific finding, and also it's quite a shock. It's quite a surprise. So a lot of those same elements that you would use in Breaking Bad news, you would need to use those anyway. So I do find it's quite useful for those cases. But I'm aware that you could actually approach this in just as like what I call like a simple medical consultation, right? Just as a diagnostic station, follow-up diagnostic station showing results. And then do a 2-week wait. Now, notice that Dr. Hansini, who's, she clarified, this is very important because doctors aren't doing this, and it's very important they do this, because if you read the Suspected Cancer Pathway Recognition and Referral PDF document by NICE, they talk about when you're disclosing or referring to the suspected cancer pathway, there's 3 things that you should do. And number 1 is you need to clarify that not everyone that's referred to this service ends up having cancer. But obviously according to the situation, right? So for example, if it's really low index of suspicion, but you need to refer them, then, you're going to be a little bit less reassuring. But if it's like in this case where it's quite worrisome because it's diffuse pleural thickening and it's bilateral, right? So if it was a focal pleural thickening, perhaps it could just be a pleural plaque or some kind of injury related to, or asbestosis itself. just a bit of asbestosis, then that's fine. You know, that can cause pleural thickening. But the fact that it's kind of very, very diffuse and it's bilateral, that's kind of a little bit worrying. So we're not 100% sure, of course. And so that's one of the reasons, you know, whether there's an argument not to use a breaking bad news approach here. But yeah, so that's the clarification. The second point is, you know, bringing in, offering to them to bring somebody in with them, a loved one or something if they wish. And the third one is to give them the choice to opt out of information, which is particularly useful for like end of life cases a lot of the time, or older patients. Often is useful. So some patients want to opt out of knowing all the details, right? And so that's also something that you can ask as well as part of invitation when you're breaking bad news. You could ask them about, you know, do they want to know all the details or just the kind of general picture of things? But obviously be careful with invitation. I generally find that if you ask more than one question in invitation, it tends to go wrong because it's such a difficult area to navigate. So I like to just pick one question that I feel is most appropriate for that particular case. So the choice of questions would be, you know, is it okay for us to discuss the X-ray results now? Or is there anyone else that you'd like to be here today while we discuss the result, before we discuss the results? And third one would be, you know, would you like to know about all the details or just a bigger picture? Because obviously when you ask those questions, it's going to raise alarm bells to the patient. So you want to quickly move on from there. Don't dwell on that area too much. That can get you in trouble, basically. So this, you know, it's not a key theme here, you know, so they're included in these notes, but I don't think it's particularly, or, you know, you could unnecessarily worry them too much, talking specifically about mesothelioma when there are benign causes of pleural thickening. So it is not confirmed. And so you won't know until they do further tests, including a CT scan and including a biopsy. But, you know, the prognosis, the outlook is not very good. Yeah, so compensation, you touched on that as well, which is nice. I mean, it's not essential, but I think it's really good that you touched on that as well because you know, that's obviously important, and that's obviously something that the specialist will be able to, if it is confirmed that it's occupational related, then you know, they would be eligible, and the specialist and the support groups will be able to discuss that with them. In terms of support groups, there's a good leaflet which I've linked to in the notes, so you can find those in the notes. But you can also just actually, for people that don't have access to my notes. So here at mesothelioma.com, very nice leaflet, which I learned a lot from before this, just when preparing for this session today. So yeah, that was really nice actually in terms of, you know, classifying the different types of pleural thickening, why this particular pleural thickening is a bit more concerning than just if it was an apical pleural thickening, for example. But yeah, definitely that's a good one. Resource to point them to. So I do like reading information to try and include that in your consultations if you can, just because it can get you out of trouble if you said something wrong. Well, at least it will be corrected when they read the leaflet that's right. So that's always good. Yeah, in terms of chunking, you know, like giving it in layers, delivering, breaking the bad news in layers. Yeah, I think you could do that. Yeah. I think generally the tempo was pretty good. The rhythm was good, which is important. Very often people are very quick in breaking bad news because the more they talk, the more marks they think they might get, perhaps. So, you know, you need to be a bit slower. You need to be talking to them like a counselor, I always say. Just imagine that it's like a counseling session. With these kind of sessions, you do need to exercise that muscle. So if you're not practicing breaking bad news, because Dr. Hansini, she's explained that she does this in her line of work quite a lot, breaking bad news. So she's you know, been doing this. She's got good experience with it. But you do need to practice. It's a very high skilled one. That's why we've started with this session. We want to start with the difficult ones. And in my opinion, the most difficult PLAB 2 stations are breaking bad news and medical ethics. They're the most difficult stations, really. They're quite high skilled cases. And so if you haven't practiced them, you should. Anything else you wanted to add, Dr. Luna?
I mean, I have nothing to say. That was really good. Especially that it was like your first time and you barely read the notes. The only thing is, like what I like to do in that type of stations, I mean, you did it perfectly, taking updates from the patient and knowing what they already know before giving them the information. That's really good. I like to start them with like, walk me through, like this sentence, walk me through what happened for you to come here or for you to have this x-ray. And then the patient might give you more information rather than you just asking small questions and taking the information from them. So that could be a good idea just to gain time at the beginning as well. But otherwise, it was really good.
Yeah, I think she did. You did ask. She did ask to walk me through what's happened. What's happened so
Yeah.
far. What led you to go to the doctors? So that was a nice open question. This is one other thing, though. This is an important topic, which is the balance of open and closed questions, which is not done well by PLAB 2 doctors generally. Yeah.
Yeah.
Balance. Her balance was excellent, by the way. The balance of open and closed questions is so important. That's why it's in the GMC mark scheme, right? That's why they make a big deal of it, because it's crucial for effective data gathering. So what are the two mistakes you can make? Number one is that you jump too soon into closed questions without asking an open question first, right? And so that is too doctor-centered, too restrictive for the patient. They don't allow them to. If there were other things outside of those questions that they wanted to volunteer, that you haven't given them the chance to do that. The alternative, the other mistake, is to ask an open question and then just take it as, fact, right? You need to follow up with closed questions to double check, because patients forget, for example, past medical history, and then you follow up with, any medical conditions, open question, then, or medical problems, and then follow up with, for example, like high blood pressure or, high cholesterol, anything like that. Follow up there to double check and to demonstrate relevance to the examiner, right? Because you're impressed in data gathering. In management, it's obvious you show your knowledge through what you say, right? Through your management plan and your explanations. But in your data gathering, you demonstrate your understanding through your selection of questions, right? And so one way of doing that is by always following up your open questions with closed questions that are related to that particular patient or to that particular case. And so another thing with open questions is that people often think, oh, one open question is enough. Often the patient will give you incomplete information. And so when a patient presents with something, you should explore what they present with. Just like when a patient presents with a symptom, the doctor knows to explore the symptom first, right? There may be other questions that you want to ask, but you ask them later. That should be the later parts of your data gathering. For a patient-centered approach, you should explore what the patient has presented with. So I'll give you an example. If a patient presents, because they often do in PLAB 2, with a concern or an expectation, which are both components of eyes, then it makes sense to explore those at the beginning. So if they're expecting a sick note or they are concerned about vaccinations, for example, then we should explore the vaccinations. What you shouldn't do is jump into, oh, let's talk about the baby and his health and the pregnancy. So like straight away, she said, I'm concerned about vaccinations. Oh, how was the pregnancy? That's what basically most PLAB 2 doctors are doing this, right? They're jumping into unrelated closed questions, right? You must explore what the person's presented with, because when they present with chest pain, you explore the chest pain first. You don't go into other things, right? You explore that first, then you transition into those other, your agenda. Okay, so always, and so when you're doing that, you need to follow up your first open question with other open questions. It's not just one. Yeah, and often those open questions are where you are just a natural human being talking to a patient. And so you need to trust your instincts. They will say things and there will be a patient cue. They'll give you a cue of, by that, I mean, they'll give you incomplete information about something that needs to be explored further because it's a key theme. And you ignore it because you've got your list of questions that you want to ask. Yeah. So you miss the key theme and you get marked down because of it. So wherever at the beginning of those consultations, these counseling stations, these ethical stations where they present not with a symptom, what you need to do is you need to explore what they've done there, for what they're presented with first, concern, expectations, with a series of natural open questions using your instincts. There'll always be a natural follow-up that they'll say, a lot of these things that they'll say, yeah? And then from there, because you're already in eyes, right, you might as well finish it, yeah, rather than do it later on, because it's all linked, isn't it? It gives a better flow in conversation. It will save you time as well. Complete the rest of eyes, then go into your agenda of the things that you want to talk about, like the baby's general health, yeah? So that is actually, and the GMC, they do reward people that do follow natural questions and don't try to be too clever. Don't think that if it's not in the script, then it's not worth asking. If it's a natural follow-up question that you would have asked in real life, chances are you should ask it in the exam too, okay? You know, the basics are important. So yeah, that's open and closed questions. Timeline, yeah, so, you know, I thought the timeline was excellent. This was good. I mean, family history, I don't think mesothelioma, if you were going to, in a lot of these cancer cases where you need to be asking family history, make sure you do signpost it, right? So I'm sorry to alarm you. You could say it's just a standard question that we like to ask for people who present with X symptom. But anyone in the family with breast or ovarian cancer, for example, yeah? Social, yeah, so social, I mean, home, the idea of asking about home is to get an idea of their support network. But the main thing, you know, and that's what all I've included in my notes there, is the work. That's the thing not to miss, really, because if you miss that, then that's a key theme, yeah? So when you are summarizing the 3 key themes, so for example, data gathering here, I would say this question here about the X-ray and what they were told about that, that's an essential question that we need to ask, because we don't make assumptions.
Yeah.
So that's one question. Number 2 is you need to ask questions about cancer red flags. And then number 3, local and systemic symptoms. And then number 3 is work. These are 3 things I wouldn't want to miss. And we'll add ice as well in there. So 4 things. Usually it's 3 or 4, right? Sometimes more, sometimes less, I would say. But generally, so that's data gathering. If you ask those 4 questions, you've probably done a very effective data gathering. Yeah? Key themes. Always focus on key themes. Because here's the thing, right? What comes next? What comes next? What comes next? And structures and things like that. You know, if that is what a student thinks, like, you know, where they're doing examination, what comes after palpation? Like that's the mentality of a student. You have to transcend above that now, okay? You have to transcend above what comes next. And you have to know those. You have to have those well ingrained, yeah? So you need to study your approaches, make sure you've got those ingrained, so that you can focus on key themes and, you know, patient-specific things, yeah? So in terms of management, so we've done that for data gathering, key themes, 3 or 4 key themes. Management. Okay, so it's a bit more tricky with a BBN approach, but what I would say is, okay, I want to explore emotions. I'm not going to miss that in a Breaking Bad news station. Yeah, because that's what you're being assessed on. They're testing you on your ability to explore emotions. Like that's like one of the main 2-3 things in a Breaking Bad news station, right? So that's definitely something I want to explore. So how do we do that? Ask an open question. Take me through what's going through your mind. And do make sure, you know, that when you are exploring emotions and you're commenting on what you see, right, that you actually comment on what you see, not what you've read in my notes or anyone else's notes, not what you expected to see given the, you know, the task, you know, so you're expecting perhaps him to be surprised, and he might not be surprised. You know, so we give an accurate description. It has to be precise as well. The more precise, the better, of what you see, okay? So that's one thing. Obviously, we're going to refer and talk about that urgently via the suspected cancer pathway. So that's a key theme. Not going to miss that. If you don't refer suspected cancer pathway, so how do you know if something's a key theme? Well, if you don't do it, then you're at risk of failing the station, yeah, because you've not addressed the key theme. So if you've not referred this patient to suspected cancer pathway, probably going to fail. Can't really come back from it, right? And the third thing, yeah, so it's obviously the delivery of the news is obviously important, right? And doing that in the correct way. So focus on your verbals, focus on your non-verbals, right? So it's not just what we're saying, we're being assessed on, you know, our non-verbal communication, which includes body language, includes tonality, includes the rhythm, you know, and the rate at which you speak, the inclusion of pauses, all those kind of things, yeah? And, you know, adapting to the patient, always be looking at the patient, be present to the moment. Yeah, so they're the 3 key themes I would say for the management aspect. Yes, so we've got that's just a summary. If anyone wants these notes, by the way, who doesn't have access to notes, just send me an email. or message me on WhatsApp. I'll send those to you. But yeah, so what did I mark you? You are still there, Dr. Hansine, are you?
Yep,
You are
still
there, I
here.
hope? Okay, yes. So your mark is going to be very high, right? It's bordering on, full marks, bordering on, very close to it. Yeah, so history taking, and the data gathering aspect, which in Breaking Bad News includes the setting. By the way, Grips was very good as well. Like, so you seem very well practiced, like you're exam ready. Yeah, so data gathering, I can't really fault it. Like, I can't not give you a 4 for data gathering, which 4 out of 4. It was excellent. Yeah. Clinical management. What do you think, Dr. Luna?
I would give a 3 just because there wasn't time at the end to do the signposting and all of this, even if it's not necessary. But I think that would be a 3 for me just because of that. But otherwise, I would have given it a 4 for sure.
Yeah, there is an argument to give a 4 for that. It's
Yeah.
like I agree that it's kind of like in between 3 and 4. But certainly a 4 wouldn't be out of the ordinary. I think that was very good, excellent. And IPS?
IPS was really good. I would give it 4 for sure. Like, no.
Yeah.
Yeah.
You can't get much better than that, to be honest.
Yeah.
So yeah, I think I agree with that. So that would be like a 11 out of 12.
Yeah.
An easy pass, and it would boost your total score very well. It's
That
good
was
to have a few of those. Yeah. No, so excellent. And thank you for volunteering as well.
Thank you very
I think that's
much.
great. Yeah, so in terms of explaining something, I mean, I would say it's like a thickening of the lining of the lung, right? That's because that is an area where people struggle because they've never had to explain something, perhaps in English, without using medical jargon. So it's a new experience. So people don't have experience with that. So do make sure for any diagnoses that you practice, go to the nhs.uk website, go to patient.info, and because that's kind of the level that you want to be delivering and talking to patients in during consultations. Yeah, so management plan's good. We referred and we clarified and we invited somebody, and we also asked if they wanted to know all the detail. Yeah, balance of open questions I thought was excellent. Yeah, understanding knowledge was excellent of the suspected cancer pathway. By the way, guys, suspected cancer pathway, you should definitely make sure you have a look at the NICE guideline, because it's quite a high yield thing to study, because you'll probably get 2 or 3 stations where you have to utilize it, whether it be in a teaching station or whether it be in a diagnostic station, a first presentation diagnostic station. Or, often you have to do these referrals. So having a good experience of doing that is important, and having good knowledge, because it's generally, from what I've seen so far, not something that's done particularly well and in line with the guidance. And obviously, this is an important topic. The way that you deliver news like this and how you manage patients in this way with such a serious condition is very important. It needs to be done right, basically. The threshold for passing is a bit higher, because if it's not done right, then that the patient's upset and they've got cancer.
Yeah.
Right.
And I think not all cancers are at 2 weeks. Like, some of them are more urgent if it's pediatrics and stuff. So you have to look into that to just give the accurate information.
Mm-hmm. Yes, definitely. So if they're 24 or below, then it's within 48 hours, isn't it? Which is the other Breaking Bad News case. And so, with these cases, that's one other thing, actually. With these cases where it comes as a surprise, I think it might be worth arranging a follow-up appointment. And the NICE guidance does talk about this. They say using your instinct. And basically, by instinct, they mean, well, my interpretation is that If it comes as a surprise, you should arrange a follow-up appointment within 1 day or two, just to check on how they're doing. Because if something comes as a shock to you, then you're not in the right frame of mind to ask any questions at that point. You need to let it absorb, and then you may think of some questions later that you can't think of right now. So if you just like arrange a follow-up call in 1 or 2 days, then I personally like to do that for these cases here where you are the life-changing diagnoses. But obviously you don't need to do it for the others.
Yeah.
Yeah, so I mean, you wouldn't get any ticks. That would be, you
Extra.
know, or they use Ys now, don't they? They don't use ticks, but yeah, there's nothing that at all that is warrants you getting a tick. Very often for Breaking Bad News, where do people often, where do they get ticks? Or in my humble opinion, where do I give them ticks? Where are they going wrong? I would say issues for Breaking Bad News. They're not understanding the issues. They don't understand what they're being assessed on. They think they have to assess the patient, medically assess the patient a lot of the time, when there are clues given in the task that that's not what you're being asked or assessed on. And because of that, they allocate time towards those things at the expense of the actual things that they're being assessed on, which they don't do as well. Time management, so data gathering too long, again, which is kind of linked to the last point, but it's a Breaking Bad news station. You're delivering news, and so you should deliver it early. Not with 2 minutes to go, right, as a little side thing at the end. No, because then you've not allocated your time properly. So definitely do allocate your time to key themes. Bear in mind, is it an assessment focus station, management focus station? There's no set time where you should be starting management. It differs according to the case. Yes, language, things like, so it says massive, right? But this is a doctor talking to a doctor, right? But you're being assessed on how you deliver news, and then you say you've got massive bleed, or your husband's got massive bleed in the brain and he's dying, right? But you say massive bleed. So any of these hyperbolic statements are probably not appropriate. You should look at that and say, I'm not going to use that same term, massive, right? I'm going to adjust it slightly say it in a more gentler way, right? So I might say it's quite a significant bleed, for example, rather than unnecessarily using hyperbolic statements. So avoid those, because often I find that people are quite abrasive, with patients in the way they talk. And so you need to be a bit gentler sometimes. So yeah, do bear that in mind for Breaking Bad News if you think that applies to you. Also, obviously, medical jargon. The issue, everyone knows not to use medical jargon, but the problem is that people don't know what is considered jargon and what's not. That's often an issue. So that's why you need to read nhs.uk, patient.info, and that will give you an idea of what's considered jargon, what's not. Certainly a PR examination is jargon. So the area where people struggle the most with jargon is examinations, when they're verbalizing examinations. They're explaining what they're going to do. They're using terms like palpate, percuss. They're using PR examination. So, do make sure that you are familiar with these. So when you are doing an abdominal examination, you're going to look, feel, tap, and listen to the tummy, right? So for some reason, that's an area people do struggle with. And also examinations, the names of examinations, right? So we could say neurological examination, you could, but I think it's better to say examination of the nerves in your head and neck, or examination of the nerves in your arms and legs. Yeah, because that makes more sense to a patient. You've communicated more effectively. And front passage, back passage, don't use jargon. So that's an area people struggle with. Examination, but the big thing is with examination is time management as well. You need to be timing yourself when you're practicing, okay, especially for examinations and combined stations. So when you're practicing with mannequins and stuff, you should practice with a 3-minute timer, and that includes the verbalizing component and the actual performing of the examination as well, within 3 minutes. If you can't do it within 3 minutes, you haven't practiced well enough, yeah, because it should be effortless. Often people go over 3 minutes because they're not well practiced enough. That's the most common reason, yeah. So only until you can do it all, verbalizing and performing, within 3 minutes, do you move on to the next mannequin. Spend the full day doing all of that, all of the different mannequins, and whilst you're there, do the teaching ones as well, and do just one of each type of SimMan. So one bleeding or post-operative patient, one obstructive airway disease and anaphylaxis, which is quite similar management apart from the adrenaline. But generally, you're breathing into your interventions a lot of the time are in breathing. You're giving salbutamol, things like that. So it's quite similar. altered mental status patient, make sure you're comfortable doing a GCS. One sepsis patient, right? If you cover one of each of those, you're pretty much good to go. Like you'll be covered for the exam. Yeah, I mean, rapport. I think with rapport that, first of all, by the way, with management, I think important is to summarize 3 key themes. Okay, so don't get stuck in one thing at the expense of others. You need to practice doing that. Dr. Aurora from Aurora Medical Education talks about putting the issues on the table, right? Put the issues on the table, so at least then the examiner knows, you know, if you do run out of time, that you were headed in the right direction. You gave an overview at the beginning. And by the way, you should be doing the same for your teaching stations, because you will also run out of time in your teaching stations. So give an overview of the topics that you hope that you are looking to discuss during the session, right? So that if you run out of time, well, they know that you wanted to talk about this and this. Yeah, so that's important, in particular for psychiatry stations, because you'll always run out of time for psychiatry stations in PLAB 2, because there's so much to cover. So everyone runs out of time. You must get into the habit of giving an overview, okay? Otherwise, you will score 0 or 1 in management, and that's the worst thing, is that you aren't rewarded for something that you should have scored because you know it, you just didn't have time. Yeah. And also with listening, you know, make sure that you are adjusting to the patient. Any volunteered information, make a slight adjustment in the way that you ask subsequent questions. Don't just ask mindless generic questions. Adapt the question. You know, the phrases like "other than" are very useful. Yeah. Or you mentioned that, you know, this, was there anything else? But so that they know that you've taken on board and you've processed what they've said so far. That's very important. Always demonstrate, because the examiner doesn't know that you've listened unless you give evidence that you've listened. So that's one way of doing that. Anything else you'd like to add? Sorry, I've been talking for quite a long time.
Someone has a question in the chat. So they are saying the doctor mentioned the type of support at the end of consultation. It wasn't clear. Can you repeat that, please? So I think she mentioned just social support and like support groups for people who have mesothelioma, so mainly support group. What you can also do in that case, if you are sure that it is cancer, then you can refer the patient to Macmillan nurses, or specific nurses dealing with cancer in the UK. However, just saying support groups, I think, would be fine without actually like naming them. Yeah.
Yeah, I mean, for support groups, it's good to have a list of like
The most
common ones that you will need. Yeah, you know, for LGBT, you know, obviously, most people know the LGBT Foundation, but also the more specific ones to the individual cases, right?
Yeah.
That's often useful, because there are lots of LGBT support groups. So knowing a few of them is useful. Which you'll find those in my notes, and also on a YouTube video as well. I've got those summarized there. But a lot of these chronic conditions, right? You need, you know, Alzheimer's. So it's good to be aware of those ones. And you mentioned Macmillan's for cancer. Also, Mary Curie for any end of life station is a useful support group that you can signpost them to. Yeah. I will at some point. I do plan to make a document summarizing all of these support groups. Actually, that's probably something I should do and add it to the notes.
But you don't
Yeah.
have to know all of them. Like a few of them would be fine. Like just find the easiest one to remember and pick that one.
Exactly. Yeah. These are not obviously things that are going to pass or fail you, but it's nice to boost. It gives you a nice boost if you do know them.
Yeah.
Yeah. Any other comments or questions from anyone?
Okay, I think we're good.
Yeah. Anything else, Dr. Luna, that you wanted to say at all?
I'm good. I think that was a really good, like a textbook example of a nicely done station. So that's really good to maybe watch again and take it as an example, because it was really well done. Yeah.
Yeah, definitely. Yeah, and it's a good advertisement for my notes, that because you followed
Exactly.
them very well.
That was really good. Yeah.
Yeah, it was excellent. So yeah, thank you so much, Dr. Santini, for volunteering. I know it's like can be intimidating, but you obviously weren't fazed by it. So yeah, really, really impressed. So well done, and all the best as well for your exam. All the best, everyone else, for your exam as well. We'll be doing some
Good
more
luck.
of these, hopefully,
Mhm.
a few sessions. Yep. Take care, guys. Thanks for coming. Let your friends know if you think they'll benefit from these sessions. We'll be doing a few of these, hopefully. We plan to. So yeah, yeah, let them know about these sessions if you found it useful. And
Good luck.
yeah, good luck, guys. If you want to find out more about me, you can go to my YouTube channel, PLAB 2 Cases, and I have a new Instagram account, Dr Hashim MLA. So just a small plug there. But yeah, take care, guys. Thanks for coming.
Bye, everyone.
Bye-bye.
Bye.